All right. I want us to start, but I'm waiting for Dr. Furman to get on, and she's not on yet. We may have to let her give her update at the end. So, but I just want to say welcome everyone to our COVID-19 session, the second of the year. We are really happy to have you all with us today. If you want to please go ahead and type in the county that you represent in the chat. That will help us again to see our reach. So thank you for being with us. I'm really excited today because we are going to have a special guest with us, Mona Huff. She's going to talk to us about providing hope during COVID and beyond. So it seems like our MD update is a little bit delayed. So I am going to go ahead and give you the bio for Mona. And then we will see if Dr. Furman gets on. She will do the update and then we'll move on to Mona. Otherwise, we'll just keep going. So Mona, thank you for agreeing to be with us today, to be our guest speaker. I'm going to tell you a little bit about Mona. We've known Mona for many, many years, and we just really, really very privileged to have her as part of our team. So Mona is a retired pastor and community educator. She's a national fellow for community education and state certified community educator. She came out of retirement to work with KIPTA and UofL on a grant for diabetes in 2010. Her current work is with the Trager Institute at the University of Louisville with a new grant that has expanded the focus to all chronic diseases with the aging population and increased geographically to include the whole state of Kentucky. Her specific duties include working with education for health in the communities and especially for the rural and vulnerable populations. One of the ways she does that is with microclinics, which is part of her subject today. Mona is married to her best friend, Mike. They have 2 children, 8 grandchildren, and 2 great-grandchildren. She enjoys prison ministry, leading conferences for both ministry and health-related subjects, reading, gardening, walking, and connecting young people and senior citizens. She feels a great deal of today's problems could be solved if more time was shared among the younger and aging generations. Each has so much to teach the other. So with that, I am handing it over to Mona to lead us into a discussion about hope during COVID and beyond. Thanks, Mona.
Thank you. So do you want me to share the PowerPoint from this end?
You sure can.
Okay, that looks like I have it there. Okay, so our goal today is to find out about healthy opportunities that are practical and everlasting. Obviously, we want to provide safety during COVID, as well as learn about opportunities that are offered for healthy behaviors, not only during COVID, but beyond COVID. Health is an important part of what we want to share from the Trager Institute. Oops, sorry, went the wrong way. So the starting point.
Slides because it's not showing up. Your slides are not showing up if you want to share some slides now.
Oh, I'm sorry. So let me see what I need to do. I don't see this.
Mona, do you see the green share button down at the bottom in the very middle of the screen?
Okay.
If you click it, it will open up all of your options to share. So if you basically, if you have the PowerPoint open and you click share, you should see the ability to share the PowerPoint.
Okay, I just did that. Is it sharing?
No.
Okay, so let me try again.
So click the green button and then click the PowerPoint and then click the blue share button down in the bottom right-hand corner of that white screen.
Okay, that's the problem. I'm not seeing the blue button. I see the share green, and of course I have my PowerPoint. Oh, it's not blue, so maybe, no, that's not working. So if you don't mind.
Click the green button, and then you'll have a white screen where you see basically all the tabs you have open. You should see the PowerPoint. If you click the PowerPoint, it'll turn blue, and then down on the white screen, and then down at the very bottom, there's a blue share button.
Okay, did that work?
Yes.
There you go. It's working.
Okay.
It's working now.
Okay.
Yes.
All righty, so we've talked about our goals, and now we're going to say farewell to 2020. But as we do that, we want to cultivate hope that there are better days ahead. We really need to look at the lessons that we learned in 2020 and how to use those appropriately. And I think there was a lot of learned lessons. And hopefully it's going to help us to be a better people and be more conscious of the vulnerable, the aging, those that need the extra attention. And then we want to make our plan for 2021. So in order to make our plan, we must find our hope. We must determine what matters to us. I think at this point that many would say that what matters really is how to be healthy and of course not get COVID-19. That's really been important to me as one who's living in that population and with a couple of chronic diseases. Even though I have them managed, I also know that makes me just a little bit more vulnerable to them. And so I have been especially careful, as I think many of our folks have been. We want to educate ourselves on how to reach what matters to us. Very often we think about these things, but then we don't do anything with them. And we need to make a plan, because if we don't make a plan, it's only but a dream. And then I think that an important part of that step to journey is to find others who will support and encourage us. The next thing we want to do is just think of some practical ways to prevent COVID. And I know that we've heard all of these things over and over again, to wear our mask appropriately. And I would suggest, if you have any questions about that, just Google it. There's tutorials on how to make sure you're wearing that properly, because if your nose is showing, then you're not wearing it properly and you're not protecting yourself or others. If someone must come into your home, then have a few disposable masks available and insist that they wear it. I know very early in the COVID, we had problems with our furnace and had to have a repairman come in. And here he comes knocking at our door without a mask. And, you know, I need to be wise, courageous enough to say, here's a mask, and have one readily available. Stay at least 6 feet from others who don't live with you. That's everywhere, whether you're inviting someone into your home, which may not be the wisest choice right now, or whether you're out in the public. Obviously, we want to avoid crowds. The more people that we are in contact with, then the greater likely we have to be exposed to COVID-19. And I say stay home if possible. But if it's not possible, which I know it's not for a lot of folks, then follow all the COVID guidelines. If you're going somewhere, call ahead and make sure that they are following the COVID guidelines. And I think that includes our doctor's offices, that we need to make sure that they understand what we expect. Stay home with any illness that you may have. And just remember that COVID manifested itself in many, many ways. It's not just a respiratory infection. Be responsible and model proper behaviors yourself, and let us find ourselves engaging in positive conversations so that we are encouraging each other. Get a vaccine if it's at all possible for you. I know that we have to wait our turns, but when it is your turn, make sure that you do that. And I think one of the things that's important for all of us is to accept the fact that this pandemic is something that we've not seen in modern history, and we probably know less about it than what we know. I know that we're learning a little bit more every day, and obviously some of the things change us, which sometimes upsets our public, but we need to help them to understand that as we learn in science, then we have to change some things that maybe wasn't just right. So let us also be very, very positive when we hear the changes, and let other folks understand what that means. The next thing we want to talk about is practical tips to maintain mental health. I would say pay attention to reliable news source that reports facts, and avoid some of those medias that just sensationalize, I can't say the word, that increases our emotions and brings forth responds. And if you need to limit your exposure, if you're finding yourself becoming anxious, then obviously do that. Let us focus on things that we can control. And some of those just include our own schedule. Having a routine at home as well as work. Often those of us who are fairly organized find ourselves very organized at work, but then home is chaos, and we really need to be organized both places. Focus your thoughts on the present and think of things to be thankful for and verbalize those often. Listen to music or read inspirational books. Lean on your own personal beliefs, your own faith for support. Look to the community for ways to be helpful. When we're doing for others, then not only are we helping them, but we're helping ourselves. Some of the things that you might consider, and again, you want to be very careful that you are keeping yourself safe, but blood transfusions are at a low right now of gifts, and the hospitals need those. So let's remember things like this. Maybe check in on our older neighbors. That doesn't mean we have to go into their home, but we can call them. We can provide a meal and say we're setting it on your front porch. We can talk to them through the door. Just whatever we can do to help life be a little bit easier for those. And of course, we can always donate supplies and money to local organizations that are helping others. Acknowledge and appreciate what others are doing to help you in your community. I've seen on Facebook lately just little words of gratitude to frontline workers, to the teachers and things like that. And let's participate in that. Let's put out some words of encouragement and try to knock down some of the negative things that are going on. Let us use technology to maintain social connections with our loved ones. And for our senior citizens, sometimes that sounds almost impossible to them, but let's try to find ways to make it a little easier for them to engage in that. And of course, we still have the old-fashioned phone. So encourage them to call people. Encourage them to consider a regular check-in for different people that they can call to see how they're doing. Not only is it going to give them something to look forward to, but it will give the person who they're calling something to look forward to. So as we think about COVID, some of the symptoms or mental health in COVID, some of the symptoms that we want to watch for is trouble focusing on daily activities. Activities that turns into feelings of feeling that you're just out of control and you really can't think properly, and that you find yourself just at a heightened anxious state. Strong feelings that interfere with daily activities. Having emotions that becomes difficult to manage, and feeling of hopelessness or helplessness. Always, always, and I know some of you that have heard me speak, have heard me say it over and over again, but remember, asking for help is not a sign of weakness, but indeed a sign of strength. Have someone that you can call. And if that person isn't enough, then get a hold of your local provider, your therapist, whoever it may be, and get the help that you need. Never, never be ashamed to ask for help. Some more practical tips is to practice pausing. Whether you use mindfulness or taking deep breaths or taking a moment to pause can just help center you and get you back to the present moment when stress and anxiety are high. You might consider some mindfulness applications like Calm or Headspace to help you release tension. Also, you might look at the Trager Institute. There's all kinds of ways that you can get help through them. Balance your mental intake. You know, there's an awful lot happening in this world, and it's easy to feel like you need to be constantly connected in order to not miss out on what's going on. But monitor that and make sure that what you're taking in is what your mind can handle properly. Check in on yourself. Just say, how am I doing? Is this time to unplug? And of course, as always, we want to encourage you to use your supports. Now is the time to use our support system as never before. If you don't have a support system, reach out to others and tell them how you are doing, and ask for emotional and practical support when you need it. And again, I would say, consider a professional if you feel that you need that. Or if someone that loves you tells you you need help. Sometimes we don't recognize it ourselves, but our loved one may. So now we want to talk about, what do you do if you have COVID? Well, I would say even before a person gets to that point, that you should make a plan. I think all of us should have a plan, knowing what we want to do if indeed we get COVID. We should have our emergency numbers available, easy to find. I know when I used to go into the homes and visit clients and I'd ask them about things like this, oh, it's here somewhere. But let's have numbers on our refrigerator and let's know what we're going to do. Make sure that our thermometers work. If we need batteries, if we have that kind, then make sure we have a thermometer for them. Some suggest even having an instrument to check the oxygen level. Have some food and drinks available, and you may even want to cook up some soups and something simple ahead of time and freeze in individual containers so that if you're not feeling well, you can just pull it out and put it in the microwave. Stay home except to get medical help. Get rest and stay hydrated. And there are some over-the-counter medications to keep your fever down. But if you're having much of a fever, you need to let your physician know that. And I think that Dr. Furman would want us to say that there are some treatments now that can help people with COVID. And so if you get a positive test, call your primary care physician and let them know, even if you didn't get your test through them, which most people are not. Well, none are right now because obviously the testing is being done, well, I shouldn't say none, but most of the testing is done outside of the primary care physician's offices. So we need to keep our primary care physician updated with what's going on. Get plenty of rest and stay hydrated, but also I'd say keep moving. Sometimes we want to go to bed and stay there, but with any type of sickness we have, we still need to move because we know that if we stay completely still, that we increase our chances of blood clots. And with COVID, I think it's even a greater chance. So make sure that you get up ever so often and walk around. Stay away from other people in your home. Use a separate bathroom if all possible. And if you must be around others, wear a mask. Monitor your symptoms very carefully. And if your symptoms get worse, call your healthcare provider immediately. So if you have someone in your home or even you, and if you're having any of these signs, then you need to call someone very quickly. Trouble breathing, persistent pain or pressure in the chest, new confusion, inability to wake or stay awake. And of course, if you see any blue lips, nails, or their face is turning blue or pale, that you know that you need to get some help. Of course, this is not all the possible symptoms, so please call your medical provider for any symptoms that are severe or concerning to you. Call 911 or call ahead to your local emergency facility, and make sure that they know that you are bringing in someone who has COVID-19, if you know they have COVID-19. If you don't, then say possible COVID-19. So what is our hope for 2021? You know, I said that I wanted to share with you something that would help us through COVID, but also beyond. And so I want to share with you a little bit about the microclinics program and tell you about it. The microclinics program is a way that we are encouraging to dig deeper for the resilience to keep on during this difficult time. We want to find a way to flourish through a pandemic such as this that none of us ever seen, and I hope we never see it again. We want to discover what matters personally during times of unrest. And there's an old proverb that says, when there is health, there is hope. And when there is hope, one has everything. And the Clinics program will help participants have health and hope, and that's what we want to offer to you. So just what is this microclinics program? Well, first of all, it's an international program designed for population health. It started in Pakistan, and now it's in Jordan and Kenya and Mexico, Egypt, India, and many others. These countries have multiple problems in health, sanitation, food access, poor economics, as well as political problems. So it came to the United States in 2011 because we have some of these same problems. Even though we think that we are a great civilized country, we still have many of the same problems. And in 2011, the first location was chosen, and it was Eastern Kentucky. I was trained in 2015, and the Trager Institute adopted it as part of their health and wellness program in 2018. Trager, we want to integrate holistic health with great emphasis on nutrition, movement, social connections, and mental health. And of course, this particular program, the microclinics, does that. What we do is we start with individuals who invite their social support. And now that we're doing it online, we've asked them to bring 1 or 2 people. When we were doing it face-to-face, we usually had teams of 3 to 5. But we had to cut the number down a little bit in order to be able to handle it on Zoom. And these can be their coworkers, it can be family members, friends, just an existing social network. I'm starting a class this afternoon with employees at University of Louisville. We have about 11 people that are starting this afternoon. On Thursday, we're starting another class, and it's open to the community. So we're trying to figure out ways to get it far and wide, because we really believe that this program is going to increase population health and help both our children, our grandchildren, and our grandparents. And one of the things that's really important about this program is it is generational. So not only is it going to increase health for all the generations, but it's going to increase relationships. And especially now that we're working with computers, some of our grandparents really feel very frightened with the thought of trying to figure out how to Zoom. But if they have a grandchild or a child that can help them, then they can learn this together. And not only will they be learning more about health, but it will increase relationships. One of the things that I really want you to know, some people think that you have to have diabetes or have something wrong with you to take this class. That's not true at all. It just needs to be someone who wants to learn how to manage or prevent diseases and wants to look at it from a holistic viewpoint. A microclinics program is an innovative, contagious health. And we believe it works because of the leverages of the social networks. Microclinics provides very simple, concrete information that is practiced together. Remember, I told you hope means practical, and we want to make sure that it's something that we can all do. It influences not only the individuals, but it empowers them with a contagious health philosophy. So I can influence my own health. I can also influence the health of others, and together, we can positively influence the health of the entire community. Thus, we will be increasing population health, and in time, we will see Kentucky become a much healthier state. It is important to note that this is not a medical model giving individual advice, but we want to strive to give good health suggestions that will meet the needs of all participants. And we will always be encouraging them to talk to their primary care physicians. So we'll talk about the 4 M's, and I'm just going to go through this part really quickly so that people kind of get an idea of what microclinics is about. The first M talks about meals, and we talk about the importance of good nutrition and not a diet. We try to get that word diet out of our vocabulary because we're not going on a specific diet. We're not worrying about how many calories we take. What we are concerned about is eating healthy. And as one eats healthy for a period of time, as they start feeling better and moving more, they will lose weight. But losing weight is not the sole purpose of this program. It is a side added blessing. We teach lifestyle changes for a lifetime. diet seems to indicate for a certain period of time. And if we want to be healthy, we have to be thinking about this for a long lifetime. Movement, we're going to teach the importance of movement to overall health. They're saying now the sitting is likened unto smoking cigarettes, what it's doing to our health. And we see so many people that are sitting before computers all the time. They're sitting, or the games, the TV, and we want people to understand how important it is to move. Some people may start by just walking in place. They may be in a wheelchair, or they may be unable to walk, but we will teach them to walk in place and to stretch until they get where they can do more. Of course, the ultimate goal is for everyone to get 150 minutes of exercise each week, but obviously some people have to start at a little lower level than that. We teach the understanding how important it is to understand their numbers. A lot of people do not know what their A1C is if they happen to be diabetic, nor do they know what it means if they do know what it is. Same thing with blood pressures and cholesterol numbers and all those. We want them to understand the importance of knowing and understanding their numbers and what they can do about them. We teach that if medication is necessary, to take it as directed and make sure that the primary care physician knows what they are taking and not taking, I might say. Sometimes people don't tell the whole truth, but we're trying to teach them to be very upfront and truthful to their physicians so they'll know what's going on in their lives. Just wanted to give you a quick little table of content here to show you how the class looks. I've had people ask, well, what do you do? And those are the titles of each one of our classes. The very first class, one of the things that we do is we just talk about the difference between juice versus fresh fruit. Now, what does that mean? Well, we know a little bit of juice has a lot more sugar in it. It has less fiber, and you don't have the fun, for lack of a better term that I can come up with right now, of chewing. There's something about chewing our food that makes us feel more fulfilled. And then we talk about exchanging some of our sugar drinks for water, and we introduce stretching. And then, as you can see, as time goes on, we're going to be doing more and more. And we align this with the teaching of the 4 M's with the Trager's age-friendly system. And of course, we know that the age-friendly system, for those of you that don't know, I guess I should say, first we want to align with what matters. Again, we want to make sure that the medication is age-friendly. If that is, if we're working with an older person, we want to make sure that the medication is necessary. We want them to know what medicines they are taking and why they are taking it. Mentation, we want to prevent, identify, treat, and manage depression. And mobility, we want to make sure that they're able to get around. And with our age-friendly health system, that does not just mean getting, walking in their home, but it also may mean that we need to help them find ways to get to the doctor and those kind of things. Our philosophy at the University of Louisville is we can flourish as we age. Aging is an opportunity. It is not a disease. We believe in health from the womb to the tomb. We believe that we cannot care for ourselves. If we do not care for ourselves, then we cannot take care of others. We believe that holistic health is essential, and that includes body, soul, and mind. We believe that health is contagious, so what we model matters. And we teach this to all of our folks, that we want to model good, healthy behaviors. And we believe that we are better when we're connected, and our microclinics program certainly fits into this philosophy. So I just want to share a quote with you from Daniel Zolby, who's the founder and the CEO of Microclinics International. With something as simple as changing our eating and exercising habits, we can combat major disease epidemics that some have said will rival the plagues of the Middle Ages. These simple steps can dramatically reduce human suffering, improve economic productivity, and create a more equitable and peaceful world. We believe that the microclinics program is an important contributor to better health. And we are eager to see Kentucky and beyond become healthier because of the work that we do with the microclinics. It is a virtual meeting at this time, as I mentioned, 10 weeks for an hour and a half. We meet once a month after that for an optional educational support. And then I wanted to share with you the classes that we have coming. We're starting one this Thursday. We still have openings from 5:30 to 7. We would ask if you are interested to please go on the tragerinstitute.org microclinic program and register. We would ask that you send this information to those that you know who may be interested in joining a class. And then we'll be having another class start in February and another one in March. And we're hoping that in time that when a primary care physician or you as perhaps a mental health worker have a client that you think is a good candidate, that you can look on our webpage and see a class that's starting soon and get them hooked up. So that's one of the reasons we're going to try to be rotating classes and keeping them going. If not monthly, at least every other monthly, just according how many facilitators we get trained. Okay, so how can you become a valuable part of this valuable work? Well, we would invite you to join our Kentucky Coalition for Healthy Communities. We meet the third Friday of every month. Normally, January is a little different. We got off schedule, but in February we will be fine. And we've joined with Project ECHO with their incredible work that they do of training professionals and community members. And the goal of our KCHC community conversations and meetings is to provide the training, the support, and the empowerment to our community members and professionals so that they may become fully integrated workers to achieve healthy communities. Trager Institute is but a small part of this. We need many collaborative partners. And at this time, we have Aetna that has trained quite a few people. We have some health departments. And of course, we have our very valuable students that are helping us so much with this. We really believe that health is contagious and we want to get that word out. If you are not familiar with the KCHC and ECHO meetings, I've given you Justin's address there, his email address, and you can contact him and he will get you on the list and get you set up. You might remember that I mentioned we have an optional monthly support, and My Health Matters is such group that I started about 5 years ago. And my people who was either doing the microclinics class, the Cooking Matters class, the diabetes self-support class, whatever it was that was going on at that time, would say at the end of their classes, oh my goodness, I just hate that this is over with. So I came up with the idea of us meeting monthly. And at that time we were meeting monthly face-to-face. But when COVID came, we decided to start meeting every Monday night. We've been doing that since March, and we are having a great time on Monday nights, and we invite any of you. It is designed for both professional and community. And right now, we're just about half and half of the number of people that we have with the community and the professional people. We have guest speakers. If you have something you'd like to share, please contact me. I would love to work you in on that. Our hope for you in 2021 and beyond is health and wellness. And again, if you go to our Trager Institute, you can find the many, many options that we have to help you with that. And I will close by just asking if there's any questions or anything that Dr. Furman or Dr. Joe Ambrosio would like to add.
No, Mona, thank you. No,
So any questions?
You went over everything very well. I mean, I think maintaining our mental health during this period is important. Being able to make sure that we stay centered and don't get wrapped up in all of the fear that is pervasive in our society right now, I think is real important. And everything you went over is good. But it needs to be deliberate and intentional, to quote Barbara Gordon. We need to do it. Not just talk about doing it, we need to do it. And I think that means that you can't have everything. So as an example, if you schedule 8 meetings a day and you want to have health in there, you can't do it. You got to give one thing up or the other. Give up health or give up a meeting. Or if you want to improve your diet and you eat hamburgers all the time, you're either going to improve the diet or eat hamburgers. You can't have everything. And I think that that's one of the hard things for us to really realize as human beings, because we do want our cake and we want to eat it too.
Mm-hmm. Very true. Okay, so for
is there any questions for Mona? Does anyone have a question for Mona about what she talked about? You can either type it in the chat. Probably the best to type it in the chat. I'm not sure that everyone can unmute themselves. While we wait for questions, I see Dr. Furman is now on. If she wants to give the update, that'll be good from the medical perspective. You're on mute. You're on mute, Christian. You're still on mute. Can someone unmute Christian?
Okay, sorry about that. We had just technical difficulties with the host had to unmute me. So thank you for unmuting. And I'm sorry I wasn't able to be on right at 10. So thank you all for adjusting the schedule just a little bit. So I just want to give the COVID update. So in Kentucky, we have 328,668 people that are COVID positive since this whole thing started. And we've had, in the state of Kentucky, we've had 3,167 deaths. So our positivity rate for the whole state is 11.6%. And they're also doing this new statistic with the average daily new cases based on the previous 7 days, like a case rate. So for the whole state, it's 69.2 out of 100,000. So how that compares, Jefferson County, we've had 60,589 cases and we've had 602 deaths. And our rate for Jefferson County is 61.9. So it's a little bit lower than the whole state. In Oldham County, we've had 5,892 cases and 54 deaths. So you can kind of see we're definitely experiencing a surge. I heard it explained nationally, there's been like 5 surges, you know, so like, I think they said like the spring, you know, was 1, and then like 4th of July was 1, and like Thanksgiving, Christmas, New Year's. So it's throughout the whole nation, it's a surge, and we're experiencing here in Kentucky. So big thing is to, you know, keep doing everything, and people are getting tired, but you have to keep wearing your mask. You have to keep doing everything Mona said. But one big thing is that, you know, the vaccine is rolling out, and there's these tiers, tier 1A, tier 1B. So on Friday at 11 o'clock, the health department announced with all the health systems that they were releasing the vaccine to 1B, which are people 70 and older. And so UofL Health, Baptist, Norton's, you know, within like 3 days, they had to suspend their signups because it's just the system is overwhelmed. They have like a waiting list of 40,000 people that want to get the vaccine. Kentucky's population has 500,000 people over the age of 70, so we're trying to get 500,000 people vaccinated, and like the health systems get just how much they get. So like UofL Health got like 1,000 a week, but sometimes they get 7,000 a week. So Kentucky's population is 4.4 million. And so for the whole state of Kentucky, we've administered 213,567 doses. So, you know, the system is working. It's just slow. There's just a lot of people that we have to get vaccinated. So the recommendation is to keep going to the websites, keep calling. Each health system has put out online, you know, the numbers and the websites. The issue is sometimes the websites crash, and if you have, you know, some people can't use a computer, but there is a phone number to call. So you just have to be persistent and have to be patient and keep trying. So so that's the big thing, is to get vaccinated. You can get vaccinated if you're allergic to eggs. You can get vaccinated if you have a latex allergy. So the benefits of getting the vaccine outweigh any of the risk of getting the vaccine, but definitely talk to your own healthcare provider if you have specific questions about getting the vaccine. The big side effects is it causes just soreness at the site. And then sometimes people do get like fevers, chills, tiredness, headache, but that goes away, you know, within a day or two. It kind of means the vaccine's working. And then, like Mona said, you know, definitely contact your healthcare provider if you do get COVID, because the treatments now, we do have a monoclonal antibody infusion that takes an hour, and all the health systems are offering the infusion. And that the reason for the infusion is to keep people out of the hospital. It's been proven that if you get the infusion, people do not end up in the hospital as frequently. So we're doing it at the nursing homes. A lot of the emergency rooms are giving the infusion and sending people home. And the infusion, you have to qualify for the infusion. You have to have positive COVID tests. You have to have signs and symptoms, and you have to be high risk. And so high risk is being overweight, having chronic kidney disease, diabetes, if you're on immunosuppressive drugs, or if you have an immunosuppressive disease, if you're over the age of 65, or if you're 55 and over and you have cardiovascular disease, hypertension, or lung disease. And ages 12 and up, people can get it if same thing. If they're overweight, if they have sickle cell disease, congenital or acquired heart disease, neurodevelopment disorders, or if they have like a PEG or a trach, or if they have asthma. So, definitely talk to your primary care provider about that. And then one thing I didn't mention, the VA is also giving out the vaccine. So if you're a veteran, you can contact the VA, and they, same thing, you have to make an appointment, and that system is working also. So pretty much all the health systems have been contracted to the health department to give out the vaccine. And that's my update. Oh, and then on the Justin put there in the chat about the Louisville Metro vaccine information. So thank you for that.
So there is a question in the chat. Well, I think it's a statement just from Samira. For those that are in a non-emergent tier, you can still put yourself on a waiting list, as I don't want to take away from another.
Yeah, I'm not sure if they're letting you do that or not. I mean, it's sometimes some people that are not in any of these tiers are getting the vaccine because, they were going to waste the vaccine. So they just gave it to the closest person they saw, so, I don't really think they're letting you be on the waiting list until you really meet the criteria. So right now it's 1B, which is people 70 and older. Let me make sure I'm saying this right. I'm pulling up my list of what 1B is. Let's see here, sorry. Okay, so 1B is 70. So 1A has already been done, which were long-term care facilities and healthcare personnel. In the long-term care facilities, so the whole state, everybody's going to be vaccinated by January 25th. And that was a rollout from CVS and Walgreens. They were contracted federally to do that. And then 1B is first responders, anyone age 70 or older, and then the K through 12 school personnel. So I know Jefferson County Public Schools are rolling it out to the fairgrounds. The fairgrounds have the drive-through, and they're starting with elementary schools and then middle schools and then high schools. And then 1C will be next, and that will probably be like a month from now or a few weeks or so. 1C is anyone age 60 or older, anyone age 16 or older with CDC highest risk, COVID risk conditions, and then all essential workers. So then they'll go after that, then to 2, which will probably be in 2 months, and that's anyone age 40 or over. And then tier 3 is anyone age 16 or older. That will probably be 3 months, and then tier 4 is children under the age of 16 if the vaccine is approved in that group, which will be like 4 months from now. So it's just going to take time for all this. Hopefully, I mean, right now there's 2 vaccines. There's the Pfizer and the Moderna, but Johnson & Johnson is, they're hoping to get approval for Johnson & Johnson in the next week or 2. And my understanding, that's just a one-shot vaccine. So that might help get more people vaccinated. Maybe there's some other questions.
So, yeah, there's this thing Yasmina is talking about. What about students who are working in the healthcare field or are doing the practicum in healthcare? Do they get vaccine priority or no? I'm just curious. Well, in our case at the clinic, we did send a list on to UofL, and they are going to help us get them vaccinated. I don't know, Christian, do you have any other thing you want to say about that?
Yeah, I mean, like I was talking to somebody from the school of Galen School of Nursing, and they're considered, healthcare workers. So the definition of students in the healthcare field, they are healthcare workers if they're in the healthcare field. So they really are vaccinating those people in 1A. So yeah, I would definitely try to get it if you're a student or in the healthcare field, and you can sign up through the fairgrounds is doing the drive-through, and that's where most people are getting it.
Yeah, so we are trying to get all our students vaccinated. It's just going to take a little bit to get everyone signed up. Then someone talked about at Walgreens that they got it just because they were there, and we're aware of that case where people were worried about losing the vaccinations, and so they just give it to the public. I mean, that could have resulted in some confusion.
I know, but they
Justin
have to be,
yeah.
They have to be in such a cold condition, you know, and if once you kind of unthaw them, you have to use them. So that's what's going on, is that if it wasn't that whole thing about being cold, then they could just put them back in the refrigerator, but they have to use them.
Yeah,
and then
Justin, that's true. And then Justin is saying massage therapists and other professionals who can't socially distance have also requested an exception to this rollout. So yeah, we're aware that it's going to be difficult to get everyone vaccinated.
And massage therapists, I would think, would be one as healthcare professionals, but I'm not 100% sure.
Yeah, yeah. Are they? Yeah, you would think that, isn't it, Justin? Are they not required? Are they not seen as health professionals? Massage therapists?
So we are not included in the state statutes as healthcare providers, and so we are technically in, I think, tier 1B or 1C, but some of us have asked for exemptions on that, and so I don't know. It's a little cloudy.
That's interesting. So Bev is asking, will the HB waiting list be completed before moving to 1C?
Yeah, I think that's my understanding, is they're not going to move to the next category until they get the first category completed. And I think they did move to 1B just because, I mean, they offered it to everybody in 1A, but there has been some glitches where not everybody in 1A got it. But I think they felt like they offered it to everybody enough that they could go ahead and move on. So 1A can still get it, but they felt like it was time to go ahead and move to 1B. So, and it sounds like from what the health department put out, they're like a week ahead. I think, you know, for the school teachers and everybody thought they weren't going to get it until February, but they're getting it now. So I think they just wanted to be aggressive by getting the, you know, kids back to school and getting older adults vaccinated. But I don't think everybody in 1B is going to be vaccinated before they move to 1C, because not everybody in 1A was vaccinated before they moved to 1B, you know, so. But definitely listen to the governor every day at 4. He's still giving all these updates and has a lot of details.
Okay. Any more questions on this or anything for Mona? Any questions for Mona or for Christian?
I know, you know, nationally, a lot of the health systems have been overrun, like in LA County. They're using the gift shop and they're using the waiting rooms as patient care areas. And they're putting up tents and everything. So I think I think we're very fortunate to be in the state of Kentucky, where our governor really shut things down right away, and where, you know, there's a lot of just differences in the population and things. So, but we could definitely be like these other states very easily. So keep wearing your mask, keep staying 6 feet apart, wash your hands. All the things that we've been saying all along are really important.
Justin is asking, is it in Louisville, is it logistics, person power, or a little bit of both?
Yeah, you're talking about the vaccine, getting the vaccine out to everybody,
right?
Yeah. I think my sense in it's that we don't have enough vaccine, because I mean, the fairgrounds is a huge space that could get a lot of people through. I mean, there were some pictures showing it was just empty, you know, because and like we have a waiting list of like 40,000 people, you know. It's just, if we had 40,000 more doses of vaccine, those people would be getting it. So I think it's really, I mean, I'm sure it's everything, you know, it's definitely a logistics thing, but I think we have enough people to give out the vaccine. I think it's just that we just don't have enough vaccine. On the variants they're finding, oh yeah, Barbara, I don't know a lot about these variants. I heard just on the news today there's like another variant they found, but I mean, this is what happens with vaccine, with viruses. They do mutate, and so some of these variants are even more contagious. Now, they're not necessarily more deadly. It's just that more people are getting the virus. So I don't know a lot of the details, but there definitely have found this new virus in the United States, a new strain of this same virus.
Whitney wants to add something to the discussion. Whitney, you have the floor.
Hi, yeah. Can you all hear me? Okay,
Yes.
great.
Yes.
I've been working with our nursing student groups out at Broadbent, and a couple of things just to kind of dovetail on what Christian was saying. So when it started, it definitely was slow, but I was out there yesterday, and they're up to 1,000 a day, and that's what they're planning on trying to continue with. And I did ask the director of the health department, Dr. Hartledge, and she said that there is an issue as far as the amount of vaccine that they can get and how they're getting it, and that they really feel like they're going to get to capacity, and they get their deliveries every Monday. And so the whole planning and logistics that go into that make it challenging. But what we saw yesterday was it was still primarily teachers, EMTs, etc. But I think, and Mona or Christian, you may have touched on this earlier. I think a lot of the over 70 folks are going to other to alternative sites, which I think is really a great idea. But I do think supply is going to be a concern, and they're doing whatever they get. If they get Moderna, if they get Pfizer, it's whatever they get, and they don't really have control over that. And she feels like that the J&J one will be coming really soon, and that's going to help in a major way. But it has like quadrupled since even last week, the amount of folks are running through there. So it is. I would encourage your students, if they can, get on and say that they're a healthcare provider, that they should try to do that, because I do think that I do think they can get in. It's just going to be the website's very challenging.
That's good, Whitney. And then the efficacy of, and also thank you for giving everybody the vaccine and all your students, administering it. It does take a lot of personnel. And then Bev was asking the efficacy of just dose 1. So Pfizer efficacy of dose 1 is about, I don't have it right in front of me, but it seemed like it was like 85%. And then after dose 2, it was like 95%. And Moderna after first dose was like 90%. And after dose 2 was 95%. I might have those confused, but both of them after 2 doses, it's 95%. And after just 1 dose, like one is 85% and one's 90%. But you should definitely get both doses, if you can. I mean, I haven't heard that there was a problem with not having enough vaccine to give the second dose, but I mean, that might happen in the future. But and then I think let's see, Barbara talked about the story where engineering students are helping with the rollout to help do it operationally. So yeah, we'll look into that and see. I'm sure there's gonna be a lot of best practices out there. And Samira said your parents received the vaccine in Broadbent over the weekend and raved about the process. So that's great. Yeah. Yeah, so yeah, Erica, right. I think we have Whitney and Angela, our nurse practitioners, and Molly, one of our staff, and a lot of people are working out there. Yeah, don't opt out of the second dose. Whitney, Dr. Nash was saying that they don't want to go through the hassle, but it's more of a hassle to get COVID. So I would definitely get the second dose. That's what all the research shows, that the best chance of having not getting COVID is having 2 vaccines. And then Mona said, that the vaccine.
There's a question. Yasmina wants to ask a question, but she said she is driving, so she can't type. Justin, could you unmute her for us? Sorry, Christian, I didn't.
Yeah, no, that's
make
good.
Sure she gets the opportunity to ask a question.
Yeah, sorry, I couldn't unmute myself, but I wanted to ask. So one of the issues that Henry County is having is that when they're doing the vaccine days for individuals, there are some individuals who can't make it on those days. And how would you get the word out about the specific days that different counties are doing the vaccines? Because they said something like they couldn't open the vial to give the vaccine to individuals who want to show up on on the unspecified days because the something about it expires. You only have a certain time frame to use the vial. Does that?
Yeah, because the viral, the Pfizer has to be kept like at a hugely cold temperature. And if you don't use it within a certain amount of time, it just kind of goes bad. So I didn't think about that, but yeah, I'm sure some of these smaller counties, it's just certain days that you can get it. I think you just have to contact the health department of each county where you are and figure out the days that they're giving it. And that's true. I'm sure that's true, that they're just certain days and times. I mean, yeah.
Barbara is indicating that KIPTA will be available to help older adults to register for the vaccine when things open up again. I don't know, Barbara, is it through their resource? Do you have to call the KIPTA line to get to this support? How's that going to work?
Yes. Yes, you have to call 502-266-5571. I almost forgot the number. Yeah, if you call 502-266-5571, that is the Aging and Disability Resource Center at KIPTA. They will have staff on hand available to help any older adult who's struggling with being able to, register online. So again, that number is 502-266, and Justin put it in the chat. So thank you, Justin.
And Mona, you did say an important thing that getting the vaccine does not mean that you will not get COVID. It has a 95% efficacy. So, that 5% you can still get COVID, but even with the vaccine, you can still get COVID. You just won't be as sick. It won't end up on the vent in the intensive care unit. That's the hope. And that's what the research showed. That's why they approved it, is that it did help, but you're right, it's not 100% guarantee that you can still get it. You can still get symptoms, but just not as bad.
Teresa is saying an important point. She said, as an ombudsman, I've been tracking the numbers of residents and staff receiving the vaccine at the facilities I cover. While the majority of the residents have received it, only 35 to 50% of the staff have agreed to receive it. The administrators are hoping that more staff will agree to take it on the second round. That is disheartening to hear. Ooh.
Yeah, there's so much misinformation about there. And we talked about this on our COVID calls at the nursing homes. It almost requires a one-on-one conversation, because I've said it just to people in general, but then you go around and meet with each individual at the nursing home. And I think the medical director can play a big role into educate people about it. But, the people just thought it would affect your DNA, which is not true. People thought just all kinds of stories that people heard that just were not true, and so they were just scared, I think. And now that everybody's gotten it the first round, they're going to come back in 3 weeks and give the second dose, and they're also going to give the first dose to people. I think we're going to have a lot more people get it the first time. And also some people didn't get it because they tried to stagger, like they didn't want all their staff being sick the same day, so like they wanted half to give it the first time, half to give it the second time. So I hope, in about a week or two, and everybody's getting their second round, I think we'll see it, that those numbers change. Yeah, just no one wants to be the first one, sometimes.
Okay, all right. Well, this is 11 o'clock. Thank you, everyone. Thank you, Mona. Thank you, Dr. Furman, for this discussion. We appreciate it. And thank you all for being on the call. And we will see you all again in 2 weeks.
Have a good day.